When I'm on script, it's a lot harder for me. Responsibility at the Department of Women's and Reproductive Health means taking ownership, using your initiative to deliver. I help organise the undergraduate rotation in Women's and Reproductive Health for the medical students. As they kind of progress through their career, they will eventually end up sort of taking more and more direct responsibility for decisions and being the person that people go to for advice and support. And I always say to people that I work with, you know, it's fine to make mistakes. The thing is about making sure that you learn from them. And I think that's quite a kind of light bulb moment sometimes for the medical students. I've always worked quite independently because I'm working with clinicians who have a lot of other responsibilities, so they can't manage the day-to-day running of the course, so that usually falls to me to do a lot more of the kind of making sure everything's organised and set up and ready for the students. The clinicians, particularly on the undergraduate medicine side, have always been very receptive to my ideas, and it feels like we work on it together rather than it being just like, you know, I'm just the person who makes things happen, but they do all the thinking. There's a lot goes into the admissions process in January time when we have to have really big panels of academics for the scholarship funding. We're trying to get the best students as early as possible. It's a big process, but always a rewarding one at the end. The thing that I think I'm most proud of is probably the amount of patient involvement we have in our teaching course. When I first started the job 10 years ago, it very much felt like we were the kind of kooky, odd people that we were having the patients so heavily involved in the course, whereas now it feels like that's become much more accepted as the norm, and I think that's a really positive step. Now I see why people have auto cues, you know. Meeting all the patients that come in and speak to them and seeing how cathartic and powerful the experience is to speak to our students, and some of the things the students feed back to us really makes a difference. So it feels like I'm part of the organisation of the course and my opinion really matters.